Good morning and welcome to the 13th in our Shift, Sustain, and Succeed series. We welcome anyone to join us each Tuesday and Thursday, soon to be only Tuesdays, as we do our best to find answers to the most pressing questions our businesses have in navigating the COVID-19 situation. For the last 3 months, our lives have been very different from what they were before March 12th, and also different than many others in our community or across the country. Thankfully, those of us living in Venango County, with very few exceptions, have remained safe from the COVID virus itself. But our current health and our future safety must remain a concern. Today, we've invited Dr. Wolfe, a family medical physician with Butler Health Systems, to join us and help us better understand what the current risks are and how we can keep ourselves safe and others safe. I'll remind everyone that we are in an ever-changing situation. Where we think we are by fact today may be replaced with new information tomorrow. In fact, we here in Venango County, we've seen some changes in the last week. Everything shared today is based on the best information we have today. If you have any additional questions, please submit them in the Zoom chat, and we'll do our best to include the information at the end of the call or in our follow-up. So with that, good morning, Dr. Wolfe. Great to have you today.
Thank you for having me.
Yeah, so to begin with, we each have a different perception of what our personal vulnerability is and what the risks are here in our own community. Can you share with us what you've observed from a health provider's perspective?
Well, it's definitely been a roller coaster, that's for sure. And who would have thought I would be called an expert within 3 to 4 months of this brand new thing, and being asked to try and give some professional opinion on something that we are all learning on, whether it be, the experts at, in Washington, D.C., to the World Health Organization, to the CDC. But, we're definitely trying our best. The observation's been definitely interesting on a few different levels. Of course, when this first started back in March, and my wife's birthday is March 13th. So Friday the 13th is kind of somewhere around there, so jokingly, I blame this on her a little bit, but there was, when this all came out, I was the physician actually on call overnight for the week. And I got probably 70 to 80 calls just throughout that week of people after hours saying, I have this, I have that, is this COVID? What do you think? And at that point, our hands were really tied. We didn't understand this too much. Testing was limited. Knowledge was limited. We only had information from China, and it was slowly starting to come to the United States at that point. So there was a lot of helplessness and worry and fear, which the first 2 weeks, once we kind of got our handle on things, saying, how are we going to even adapt on the ground to still maintain safety yet provide care, was quite the whirlwind. And as we've gone through this, I've seen a lot of people, not a lot of people, but almost everybody, which is very refreshing, kind of listen to the professionals, listen to the experts, say, this is the real deal. This is a legitimate threat to not only our community, but the entire world. And people for the past several weeks have limited their distances and have limited their travel. I know not perfect, but a little bit goes a long way. So what's changed actually from the first few weeks were definitely infectivity. Oh my goodness, do I have it? Now it's kind of converted almost into the psychological realm, saying, oh my goodness, how long is this going to go on? Because we're not seeing a lot of ill people here. So why do we have to keep doing this? And I'm trying to encourage people to say what we do here is just as important as what they do in Philadelphia, Chicago, Idaho. Because if we let it kind of blossom here again, it can potentially come back around. So, it's definitely been hard for everybody, regardless of what you're in. I know the businesses have really, taken a hit, and it's been really, really hard. But what's really impressed me with them is their adaptability, their innovativeness in order to still get certain services out there, which has been really nice. So we're about 16 weeks into this thing, and people, obviously not 100% of us, but a majority of us are still listening to, hey, this is what we have to do in order to keep our future safe, so that we don't have to experience this again.
Yep. Yeah, thank you for those comments. You know, I'm with you. I think it's been impressive how well people have listened and done the things they need to do. And so now let's see if we can continue through the summer.
Yeah.
How is COVID different from the other infectious diseases that we normally are treated for or threatened by here in a rural community? I know we hear it almost every day. It's just the flu. How is this different for us here?
Well, first off, influenza is different than coronavirus. Surprisingly, coronavirus, there's thousands and thousands of strains. So we actually see the coronavirus each and every single year, but in a different strain. It's called the common cold. That's actually what it is. Influenza is different because influenza is more lethal than these other strains of coronavirus. Surprisingly, it's about 0.1% fatality for the flu. And we worry about that every single year. So we ask people to get vaccinated. This year, just to talk about the flu for a second, we had one of our lowest records of mortality related flu deaths for decades. We had under, I believe, 25,000 deaths in the entire country from flu, when in fact, normally we hit somewhere between 40 and 60,000, which is dramatic. It was great. And so the flu vaccine actually hit it this year. We did a good job. Coronavirus, our immunity can't protect us. It's never seen it before. It doesn't know what to do. From a pathophysiology standpoint, I know we're not going to get into too much science. Don't worry.
Thanks.
The virus attacks the smallest part of your lungs, and that's where a lot of the fluid shifts can change, because the difference between air and blood, it's a very narrow area. So fluid will get shifted in and out of that and actually cause fluid to accumulate in the lungs. That's why it's been so difficult to ventilate these people when they start going downhill. It's really hard to get that out of there because we don't have a treatment to eliminate the virus to make him stop doing that. And it's not necessarily the virus doing that. That's what your immune system is doing in order to try and protect you. But in fact, it's doing something worse. So it's been quite the struggle.
So it's definitely different than the flu.
Absolutely. Yeah. The mortality rate right now, given the fact that testing, people can knock testing as much as they want. However, if you look at Pennsylvania testing rates, it's actually been highest over the past 2 or 3 weeks. It's been ramping up and up and up and up, which is very good. But what's interesting is that the mortality rate has still stayed about the same, regardless of where you are in the country. It's somewhere between 6 and 8%. And different states have different rules as to when to test, different regions and different doctors have different sensibilities. But I mean, that's really, really high for how many people have been, that have been exposed to this. So it's definitely a serious threat.
Are we safer because we're here in Venango County and the count's low? You've kind of addressed that, but a lot of people are feeling really safe right now.
The way we live our lives already, I think Venango County residents kind of like their space, and that has helped to some degree. Where I come from, my original hometown is Lock Haven, Pennsylvania, and that's in Clinton County, central Pennsylvania, Appalachian. It's just on the western part of the Appalachian Mountains, and very rural like this. Probably a little more population, but what's interesting there is that there's a lot of deep valleys, so people are living a little bit closer, just a little bit, but they've had almost 10 times more cases than we have. Here, it's a little more flat. We're starting to approach a little bit of the Midwest. People have a little bit more land. People don't mind staying at home and tending to their land and their gardens and being outside. So I think the way we live here, just the way it's been laid out, has actually benefited us a great deal.
Great. Well, are there things that we can do, besides distancing and wearing masks, that we can do to protect ourselves and our families against getting COVID? Are there, and I'm really thinking of those things like, are there good health habits, food and exercise, just general things that you would say, if you do these things, you might stand a better chance of either not getting it or, being able to face it stronger?
Yeah, obviously the typical things that we preach in the office, just good health habits in general, getting enough sleep, trying to exercise. Now is actually a good time. A lot of people that they're off, now is a good time to actually focus on their health, eating right, washing hands. I was reviewing a study where it was actually from a military boot camp, and they said those who wash their hands at least 5 times per day decreased office visits. Not just, this is years ago, so this isn't coronavirus, this is just infectivity. Those who wash their hands 5 times per day cut down office visits 45%. Washing your hands 10 times a day almost doubled that. So that's very important. Coughing into the crux of your elbow. Masks, those beloved masks. Everybody's actually lately, people have been asking me, so do I have to wear this mask? I have an illness that makes it really hard to breathe. Well, on the flip side, you're going to have a little harder time breathing if you potentially contract COVID. And cotton masks, although not necessarily breathable from a respiratory standpoint, has been shown to be quite effective. We know this virus actually doesn't live on cotton very well, less than 3 hours. Interestingly enough, in medicine, where we like to use stainless steel on everything, stainless steel instruments, coronavirus can last more than a day. And cotton, is when worn fitted properly, can definitely decrease your potential risk of spread. So I'm going to go back and just talk a little bit about spread when it comes to, the mask. But let's say no one's wearing a mask. And when we look at viruses, we look at how infective they are. Measles is incredibly infective. For every one patient that gets measles, they can infect 18 people. And then imagine that next person does 18, that next person does 18. All of a sudden, you've got a massive pandemic, which is why we like to vaccinate against measles. Coronavirus, although it doesn't sound like much, has a vaccination variability of 2 to 3. So for every person that gets it, it's 2 to 3 people. There's a 5-day period where people might not be symptomatic and not know they have it, and then they can actually go throughout the community and spread. And the calculations based on some of the models, where if one person gets it and then you follow all those rules, in 2 months, that person can infect potentially 20,000 people and cause 100 deaths with coronavirus. So the masks are very, very important. Social distancing goes along with that as well. Although 6 feet is a very loose rule, and it's actually quite funny how they came to the 6-foot rule. I could probably talk about that forever. It started with a 3-foot rule back in like the 50s. There was a meningitis outbreak, and they measured actually where these kids sat because this one girl infected 4 other classmates. And so they measured it, and they said it was 2 to 3 feet. SARS-1, which if we all remember that back in, I think, somewhere around 2000, which didn't hit us, what they found out, that's actually when it went from 3 feet to 6 feet because there was a woman on a plane who infected someone nearly 7 rows up. And so what they said is, although they couldn't make it 7 rows, which would be several feet, they said, you know what, let's double it. And although it's not entirely scientifically proven, they are seeing if people are within 6 feet of someone else for more than 15 minutes, that's when the risk of infectivity is highest. So wearing that mask, surgical masks that we get, are about 95% effective in preventing us from spreading it to you. That's actually what we're looking at. It's not necessarily to protect ourselves, it's to protect others in the community. We're a community here. Let's protect each other. So if I wear a mask, I'm preventing my droplets from getting to you. Same with the cotton mask. It's not necessarily that it's not going to get things in. It's going to be more that we're not going to spread something in the event we don't know that we have it. And just with the vaccinations, now is the best time than ever to make sure you are up to date on your vaccinations. I know right now the flu vaccine is not available because we're outside the flu season, but is coming in September and October. making sure your children are vaccinated. Heaven forbid we we ignore all these other ones, measles being super infective, and then all of a sudden we say, well, we better not take them out to get their vaccines. Now all of a sudden we've got a coronavirus problem and maybe a measles problem among all the other infectious diseases we can vaccinate against. So we're trying to limit, we're trying to do damage control a little bit here, and that's that's really, really important, because otherwise, if we're worrying about all this stuff now, this thing can last months and months and months. So
kind of a little follow-up to that last one about doing things to protect ourselves. So if I'm really healthy, I'm eating right and doing those things, can that protect us against COVID? Or the truth of the matter is that is anybody, because we hear that it's more seniors and, a vulnerable population, but have you seen young, healthy people that have been infected?
yeah, yes. Actually, I believe one of the first ones in Venango County was a younger adult, believe it or not. My friends, I have a lot of friends who work on the eastern part of the state, Lancaster, Northampton, outside Philadelphia. My one friend, my best friend from med school, is from Northampton. She says, all these young professionals, they're driving from New York and then going to Philly and then coming here. So she's seeing a very large 20s to 40s population that do this. Remember, a strong immune system is most likely going to take care of this for more than 90% of the population. But what we need to do is we need to make sure those that are vulnerable, those with asthma, those with COPD, those who are fighting cancer right now, diabetes, it takes all of us to make sure we protect them when they're most vulnerable. So all those things where, you're eating right. I used to laugh at my mom. She would hear, when I went through residency, I would call her and she'd hear me sniffling like every week, because I was in Pittsburgh. I was never exposed to those diseases versus like back in Clinton County. And she'd be like, did you drink your orange juice today? And I said, yes, Mom, I drank my orange juice. But my mom has no medical background and she just knows vitamin C is good. So, and she's telling me sleep right, maintain a healthy diet, take time for yourself, do all those things. We also know, just during all this stuff, although sitting is not necessarily the new smoking, we do know that sitting for 8 hours a day for work does increase your cardiovascular risk by 10 to 20% potentially. So all these things, put them all together and make yourself healthy is going to give you your best chance to fight off COVID.
I'm glad you said that last thing, because actually, as I put things together, that was one of the things I thought about. How good is it that I've been sitting at my desk for 10 hours a day for the last 8 to 10 weeks? I'll try to get up and take a walk today. I bet that would be a good idea. Well, of course, Dr. Wolfe, a lot of what you've told us is really consistent with what we hear from experts, but we also have things changing every day. I mean, for any of us that turn on the news, it just seems like we keep getting different things. Are you getting conflicting information, or do you feel like what you're getting is pretty solid? How do we know what we should believe and what we shouldn't believe right now?
Boy, is it hard with all the media outlets, and even, whether it be social media, professional media, extremely hard to decipher all this stuff. So much I've kind of shut off a lot of that stuff as well. I look at some of the feeds, and if something catches my eye, sure, I want to hear about what research is going on about vaccinations, but I also have a reasonable expectation as to when that's going to happen and if it's going to happen. Dr. Anthony Fauci, he's a great man. Haven't heard too much from him lately. Not sure why, but I'll tell you, his message has been extremely consistent throughout all this. We all think of him very highly, at least here at Seneca Medical Center. We have there's like a Bible for medicine. It's called Harrison's Internal Medicine. There's thousands of contributors. He's one of 5 people that get the name on the front cover. So he really knows what he's talking about. And we really value his opinion. For us, even just throughout Butler Health System, we were getting updates every day at first. This is how we're going to do things. This is how we're going to do things. So we had to be quick on our feet, make adaptations, make sure we kept people safe, patients safe, ourselves safe, nurses safe, and still try and provide some type of care and education to the community. So, this has definitely evolved to, I was told to just do phone and video visits to start. I was then asked, hey, you might want to work from home. And then they said, hey, we're going to bring you back a little bit for emerging cases and urgent cases that need to be seen in the office. And now we're going to slowly kind of reintroduce you back to the real world and how it used to be, granted with masks and protective equipment. So anything anything is up for grabs. Yeah, and I'd like to say, Pennsylvania's numbers, if you watch the Department of Health, they look really good. I mean, they've been going down. And the tough thing is, on Friday afternoon, we heard we got 5 new cases in Venango County. So I was all ready to say things are looking good. I'm very optimistic. But now with a weekend in between, we have a really hard time trying to hear, hey, where'd these 5 cases come from? Was it community spread? Were they in Philadelphia? Were they somewhere in a high risk population? Are they a family? Are they completely different? So now we have to kind of read and react to this little micro burst and see, is this going to cause community spread? Because from what I know from the first cases we've had, these weren't community by definition. They were somewhere, they had a connection to a higher risk area, and then they came here, got and were positive, but then they kind of shut it down and didn't let it go to the community. So kudos for not letting it go throughout the community. But now we need to see what we're going to do with these next group that popped up. Hopefully it was just an aberration, and we can keep pushing forward to say, hey, let's get our community, opening up a little more and feeling better.
Great. Well, I only have a couple more questions. So I do want to remind everyone on the call of a couple things. One, we've got the chat open. So if there's something we haven't hit and you're afraid we're not going to get to, feel free to throw your questions or comments in the chat. Also, of course, we follow up every one of these sessions with, any references and information. So you'll know where you can get a hold of Dr. Wolfe if you need to. We have other information about and recordings of all of our sessions and the registration for future sessions. So you can check those out on our website. And Dr. Wolfe, you shared with Tessa and I just before the call, someone you read. Are you willing to share,
Sure.
someone that you look
Yeah.
to? We can put the reference in on our website as well.
Yeah, definitely. Dr. Atul Gawande, and I'll have them spell it for you. He's essentially a world-renowned surgeon from Massachusetts General. He's been a pioneer for multiple things. He's a big guy into standardization and understanding, if we keep doing a pattern the same way over and over and over, is that going to lead to consistent, effective results? And he's been a big contributor to the New Yorker for information. And the New Yorker's been nice enough to, anything that he publishes regarding coronavirus has been free to the public. So even if you, I know you guys will provide his name, but if you Google Atul Gawande, the New Yorker, you will find probably 4 or 5 different articles from him that are quite easy to read and very informative, and not heavy on the science. Okay, just how you apply it to day-to-day life.
Great. Well, you mentioned that your office is open now. You're taking appointments, I know. Some of us may have been nervous to come to the doctor or to the hospital in recent months. But if we do start to feel like we might have some symptoms, we're now hearing that, if you're symptomatic, you might actually have had a headache, your eyes hurt, or some different things. What should we do if we're feeling like we're not at our best?
Yeah, any acutely ill symptoms, and I could ramble off a bunch, but I'll just ramble some the common ones, which are flu-like symptoms. You feel achy, you've got a fever, you've got sweats or chills, you've got a cough, shortness of breath, sure, headaches. What doesn't cause headaches in America society, it seems like. There's been some cases in nursing homes where only nausea and vomiting were coronavirus positive. The funny one, or the interesting one, at least to me, is loss of sense of taste and smell. This has come up a handful of times where people have that symptom and then they test positive for COVID. It seems to be rather unique to this virus. So call us first, kind of stay at home, give us some information. Let us figure out if we want to COVID test you. And I'll tell you, we're not being restrictive on COVID testing. Don't worry about people saying, oh, we're not getting the right numbers because doctors don't want to test. My threshold to test has been very, very low. Whereas if anybody feels off a little bit, I offer it and I give them the opportunity. We have plenty of test kits, at least in this area, and we're okay with that. So call us. Don't go to work at least that day. Let us walk you through it. There are some guidelines from the Department of Health as to what we do about getting people returning to work safely, whether you be a healthcare worker or someone out in the community. There's actually different guidelines, and we'll help you walk through all that stuff. And if we have to see you in the office, sure, we'll definitely bring you in. We'll make sure everybody's safe. We'll make sure we disinfect everything and keep you safe and our employees safe so that we can figure out what's best, because it might not be coronavirus. It might be something completely different, and we can treat you and we can make you feel better.
Great. So this wasn't exactly on the question. I don't mean it as a gotcha, but we can trust the numbers, what we see. I know we see those
Sure.
low numbers and think, wow, how did we get so lucky? You feel that we can trust the numbers we're reading?
For the most part, yes, I think. And just because we've had so many weeks to do this, that we've gotten better with our testing. Before the testing, there was lots of false negative rates, and there is some false negatives, but I think the technique people have done to administer the test, people have gotten better because they've had more practice. And also, it kind of goes along with just how this virus works. We're almost seeing that the charts map out what we expected. And if you follow the European Union, which was 2 weeks ahead of us, our charts actually were following them until we started opening maybe a little more aggressively than them. They have a different policy than us. So you can actually see the divergence of our cases, meaning we aren't going down as quickly, versus the European Union, where they are seeing their cases go down a little bit more quickly.
Great. Well, so we all want to know, looking into your crystal ball, when will we feel safe? Like, what are the things that can allow, if me to start feeling like it's better to move around the community, start opening up and doing things? Are we there yet? Or, what are the indicators that here in Venango County we can feel safe?
Well, I suppose if I was speaking to I'll reference my mom again, who's been dying to see the grandkids. When can she come out? When can she come out? That's probably the biggest question I get, actually, is when can I go see my grandkids? And anybody, even in the office, are asking me that question. I think there's going to be 2 points in time where we're going to feel safe. And unfortunately, in between, we might see a kickback. June is looking okay, so I anticipate July and August is going to be even better, as long as this little 5-case blip doesn't become a pattern. If it does, everything I say today is out the window, and we almost go back to square one to try and protect our community. If it stays where we continue to see dropping cases, where Pennsylvania is now typically under 500 to 400 cases per day, I'm going to think July is going to be looking very good, along with August. I do worry about the fall. Viruses tend to not like the summer. However, Brazil is disproving that right now. They're near the equator. They have some of the highest numbers on record, but granted, their population density is much different. So people are very, very closely knit, and this thing can spread like wildfire with that. Luckily, like we said before, our community is a little more spaced out. That might bode well for us come the fall. So I think there's some cautious optimism. I think the masks are going to be here for a while. I wouldn't rest on our laurels when July and August comes, and then, we start seeing different pockets in the country where maybe September, October, we start seeing a little bit of an uprise. A lot of people on the East who live in Philadelphia, those that I've talked to are like, oh, second wave, it's coming. Like they don't even say anything. It's just a statement. They're like, we're going to see it. And what's hard for us is that we didn't really see a first wave. So we don't know what they experienced. We don't know what they felt. We didn't know what it was like to lose 1,000 people to coronavirus just in their county, which that's what happened in Northampton. So they're almost numb with it and just saying, oh yeah, we got to put up with this again. So I really want people just to be very diligent to say, I know it's not here, but let's keep it out. And that's where the masks, the hand washing, staying healthy all goes into this. I think we're going to be hopefully allowed to get some festivities going. We're all dying for Apple Fest coming up in September. But I think we're all going to need to have a lot of common sense when it comes to, I mean, that's a tightly knit area that we get everybody squeezed in there from all different parts of the Eastern Seaboard. It seems like they come in here, and we're going to just have to be, I think there's going to need some policies created to keep people safe. I don't know how that happens. I'm not in politics per se, but or a policy writer for that matter. But it's definitely going to take some really hard look at things to say, is it worth it? Knowing that potentially we could put a lot of lives at risk, and I guess time will tell. So
yeah, I know those are important considerations for us. Our next event is a golf outing, which we think we can keep everyone kind of spread out and safe, and our numbers are
yeah,
low. But
yeah,
Oil Heritage coming in July is a few weeks away. We know there are things we can't do safely, and other things we'll have to look at where we're at. But we will certainly take everything you've said into serious consideration as we make our plans. Certainly want to give you the opportunity if there's anything else you'd like to add before we finish up here. We're just about at the 30-minute mark.
I I don't know. I think that was fairly. I think I covered most points that I wanted to. Just the big thing is be socially responsible. Understand it's not always just about me or you. It's everybody. Even when I talk about the flu every year, I say if I'm pumping gas at Sheets, I don't know who's on the other side.
Right.
And I don't know what's going on with them, or what their medical stuff is. And heaven forbid I cough and I totally get them ill. That's what we're trying to prevent. And I do know at some point this thing does have to it's going to infect more people potentially. I mean, that's what pandemics do, but we really got to make sure those that are at most risk are protected. And as a community, we got to do that together.
Great. Well, thank you so much for joining us today. I hope everyone found this as informative as I did. I know for me and my team, who are all in the call, we want to stay safe and keep our community safe. So reminder that we will meet again on Thursday. We'll be talking about public relations and your messaging in opening up. And then next Tuesday, we'll be talking about nonprofits and the important role they play in the community and how we keep them with us through a really difficult time, and how they're kind of meeting us where we need them. So again, thank you. Enjoy this beautiful day. Get out,